The new protocol of universal immunization program may, what are the things involved? MR vaccine, JE vaccine, rotavirus vaccine, H influenza vaccine, not the influenza vaccine, have been included. So what is the new UIP? When did they start? The latest national immunization schedule for infants and children, new guidelines came in 2016. इसलिए फटाफट सीट मारो, नहीं तो एवरी ईयर एसपीएम वालों का स्लीप प्रमोटिंग मेडिसिन वाले रहते ना, कम्युनिटी मेडिसिन वाले, उनका तो रोज रोज गाइडलाइंस बदलता और फिर आप यू विल कम बैक टू द सेम पॉइंट, राइट? एट बर्थ BCG, OPV 0, hepatitis B दे दो. 6 weeks, OPV 1, pentavalent vaccine 1 and rotavirus 1, especially in certain states. Andhra Pradesh, Orissa, Haryana and Himachal Pradesh. Only you give rotavirus बोल रहे, इसलिए क्योंकि गुल्ट गाइस है ना, तेलुगु गाइस, एपी में, एपी और ओडिशा में डायरिया रोटावायरस बहुत मशहूर है. Haryana and Himachal Pradesh also. Then 10 weeks of age में OPV 2, pentavalent vaccine 2 and rotavirus 2. Once more 14th week पे OPV 3, IPV, pentavalent vaccine 3 and rotavirus 3 is recommended. I mean IPV if at all, the earlier immunization was not there. Then 9th month of age, measles and vitamin A first dose. 16 to 24 months, DPT first booster, OPV booster, measles second dose, vitamin A second dose, Japanese encephalitis in those endemic districts. And 5 to 6 years, it is the DTP, DPT second booster, 10 to 16 years, TT. Kyun 10 to 16 years TT? Because the boys will fight for girls and then get lot of bruises and time to take the TT is what you need to remember. So doctor, next week in UMedico app, just click on remind me this like a slave. हुजूर, आप तो बोलने के लिए, तशरीफ करने के लिए बोला, ये है important table बोल के UMedico will keep reminding you like a personal learning companion, right? Our guys are even doing software guys are doing artificial intelligence. आप quiz कैसे खेल रहे? Based on that, they will create a personalized plan for you and keep giving you suggestions. भाई ये पढ़ना है क्योंकि ये आंसर रॉन्ग किया तुमने. ओवरऑल क्रॉस सेक्शन कैसे आंसर कर रहे, राइट? सो डे बाय डे machines are becoming more intelligent than the humans. Of course, that's good sometimes. Now, doctor, what is the recommended isolation period in measles? Once more, MMR group of diseases, कम से कम उसका incubation period, isolation period बट्टी मारना पड़ता. But before that, let's talk about the measles. Measles has got a prodromal eruptive post-measles complications. Incubation period होता है 7 to 18 days before the rash. So the earliest exposure that happened is 18 days before the rash. Then you have a prodrome for about 4 days. 4 days before the rash, it is the plausible start of the infectiousness. Then the rash is about 4 to 6 days. So 4 days after the rash, he is still infectious. That is the time where you need to give up to 4 days after the onset of the rash, you need to give the isolation. So doctor, how is measles transmitted? All of them are droplet airborne only. Only varicella can sometimes be direct contact. 10 to 12 days is the incubation of measles. 16 to 18 is the incubation of mumps and rubella. 14 to 16 is varicella. One of our preventive medicine professor used to say, कुछ भी नहीं याद आए तो 2 week बोल के बोलो. Incubation period पूछे तो generally it will be correct. Only thing is, examiner asked what is hepatitis B का. वहाँ भी the same rule applied and we said, sir, assistant professor साहब ने class में बोला, तो 4 days after rash, isolation for measles, 5 days after parotitis in mumps, 5 to 7 days after the rash in rubella, and 1 to 2 days prior to the rash until the lesions are crusted in case of the varicella is what you have to basically remember. Nikki Arora says, sir, I am the topper but from the bottom. Highest number of minus 200 marks आया sir मुझे. So good. चलेगा, कुछ भी चलेगा. Even if you get negative marks, don't worry, doctor. You give 300 hours to Dr. Murali Bharadwaj. Hold my hand and join the journey. I will make you to sit on the top 10 rankers. There is no rocket science or big deal about entrance exam. It's only a question of you should tell your girlfriend that Thursday, Friday, Saturday, Sunday चारों को weekend नहीं बोलते, खाली Friday को weekend बोलते हैं internationally. India में Saturday को weekend बोलते हैं बोल के just to slightly decrease your engagement, right? But I don't say completely no, because ultimately you may get a seat but you lose your girl, no point. But give a little 2-3 hours of focus between January to June, between July to December, 4-5 hours. Last November, December में get into that coma state and spend most of your time only with the facts and figures. Enough, you'll get the seat, right? So don't worry for anything. Whether you get seat or not, I am still there every evening with you. That's my promise until you get the seat. Which is not included in the quadruple test in Down syndrome. It is the inhibin A but not inhibin B is a well-known fact. So, one of the favorite questions of the examiner, doctor, please don't forget. Down syndrome में first trimester में what are the indicators? Second trimester में what are the indicators for Down? They both are not same. Typically, the NT levels are high. Fetal beta HCG are high, 2 times of the normal. PAP-A is typically low, 0.4 into normal in first trimester. Whereas, in second trimester, your AFP is low, 0.75 of normal. Estriol is low, 0.72 of normal. HCG is elevated 2 into normal. Inhibin A is also elevated 2 into normal in the case of the second trimester in Down syndrome. There is a difference between first and second trimester. You should be very, very sure about. So, doctor, at the 16th week of gestation, if you do quadruple test, how will be trisomy 13, 18, 21 and neural tube defects? Favorite question of the examiner. AFP is elevated in neural tube defects, omphalocele, gastroschis, multiple gestation, twin pregnancy mein. Whereas it is decreased in all the 3 trisomies. And if you look at the estriol levels, there is not much of importance in 13, but both 18, 21 mein it is decreased. But between 18, 21 main difference is HCG. HCG is elevated in Downs and decreased in 18. Then inhibin A levels are increased in Downs and decreased in trisomy. This is what you have to emphatically remember and tell, bookmark and reminder in the U-Medico notes. Which is a non-ionizing radiation. Even डिप्लोमा नर्सिंग स्टूडेंट को पूछे तो भी बोलेगा कि एमआरआई में मैग्नेट होता है, रेडिएशन नहीं होता. सीटी इज लाइक 10 एक्सरेज टेकन वन टाइम, सो इट इज ए आयोनाइजिंग रेडिएशन, ऑल ऑफ यू नो वेरी वेल. Oh my God, सोडियम फ्लोराइड का कलर टेप क्या है? वंस मोर डॉक्टर, फ्लेबोटमी में पोस्ट ग्रेजुएशन के भी यही क्वेश्चन बैंक है, राइट? सो यू वांट टू बिकम ए ट्रांसफ्यूजन एंड फ्लेबोटमिस्ट आल्सो, सेम पेपर. सोडियम फ्लोराइड का वो वैक्यूटेनर ट्यूब्स रहता है ना डॉक्टर, उसके ऊपर का कलर कोडिंग एग्जामिनर विल आस्क, राइट? सो ग्रे is the color. So this is the sodium fluoride vacuum blood collection one, right, where you have the gray color on the top, right. Now I will take you through a run tube of what is the color coding of all these tubes in the lab. Gray top tube is for anticoagulant, antiglycolytic like sodium fluoride, which you will be adding into the blood sample. I mean, when you are collecting blood to maintain the glucose levels. Then royal blue ka top tube, where do you use it? Iron, copper, zinc assessment के लिए blood ले रहे तो. Then similarly, it is purple if it is EDTA, then green if it is heparin, and is red if there is no additive. The label का color. Label का color और top का color अलग-अलग चीजें हैं. So too much of load on the brain to remember, at least until exam. नहीं तो जिंदगी तमाम blood sample collect करते हुए बैठना पड़ता. Yellow top tube. It is for the acid citrate dextrose for paternity testing. Agar if there is any sex scandal, Swamiji is there. To detect paternity testing DNA, you use yellow top. Easy to remember, no? Sex scandal, Swamiji is yellow. Kashay vastra hote na. So easy to remember. Paternity testing के लिए acid citrate dextrose. Then polyethanol sulfonate के लिए भी ये use करते. And that is a yellow top tube. So it's a typical sodium fluoride which is used as an inhibitor of glycolysis in combination with EDTA oxalate. So it is the gray is what you need to remember. So the purple top tube for the anticoagulant EDTA binds calcium and plasma and whole blood. Green top tube for the anticoagulant heparin. You will be using the green top tube. So these are all the sodium fluoride, potassium oxalate and the EDTA tubes in one shot. You can be able to see how the tops typically look like, right? What is safe in renal failure? What is safe in the hepatic failure is a favorite list. Once more, you medico में bookmark करने वाला चीज होता है. Amiodarone is safe in renal failure. So what cardiac drugs? A lot of times cardiologists, nephrologists work together. You know that very well. क्यों? Cardiologist के हाथ में अगर मरना है तो बहुत खुशी की बात है. क्यों? एक एरिथमा आएगा, वो ट्राई करेगा डीसी शॉक देने के लिए, आप मर जाते. इजी डाई. नेफ्रोलॉजिस्ट तो रोज आके हीमोडायलिसिस करेगा, मशीन रहेगा, हेपेटाइटिस सी इन्फेक्शंस आएगा. ओह, the last thing I prefer to die is in the hands of a nephrologist. Cardiologist is, you can smile, one of your students is a DM cardiologist. He says, bye bye, sir. This is definitely VT broad complex tachycardia, not a SVT. You only taught me. Right now you are having VT, sir. And slowly you can go into hemodynamic collapse. He will say, there is no use even to do the DC shock. छोड़ दो इसको. Let him peacefully die, Dr. Murali Bharadwaj. So it's always good. Certain deaths you should be lucky enough. Dying during sleep or Abdul Kalam's death is the greatest death. एक lecture दिया, happiest thing that he always enjoys, and then passed away. So one should be lucky. So doctor, if you look at the antiarrhythmics, amiodarone, no adjustment is required. Antiarrhythmic dosage in renal impairment. Similarly, diltiazem, metoprolol, carvedilol, propranolol. There is no changes required in renal impairment is what you have to basically remember. Swapnil says doxycycline was also there in the option. Of course, once more there is another list. Antibiotics, renal failure में क्या इस्तेमाल करते हैं और what you will use in hepatic failure.